And good morning. We continue on the South Shore's Morning News on 95.9 FM, WATD. I'm Rob Hackala. Time now to check in with Dr. John Hayes Jr. of Marshfield. He joins us every week at this time in studio as we talk about his direct primary care practice. It's on School Street in Marshfield. You can find out more at drjohnhayesjr.com, drjohnhayesjr.com. Dr. John Hayes, good morning.
Rob, good morning.
Well, here we are, end of May. I can't believe it. Okay.
I know.
Well, we're going to get into, a topic. This one's a big one for Dr. John Hayes. Daily stretching does what?
Yeah, this is another really good article to reference on the blog because I wrote this one with Sienna personally, but there's some really, really important points on this. So those of you who know me personally or maybe not, I have actually been contacted by some other listeners out there about what we do, which is pretty cool.
Okay.
Because they've heard me talk about this, but stretching. So the thing with stretching is it's so cool. So if you follow athletes and you take a look at sports in general, professional athletes especially are really diligent about stretching. Why? Well, you go back many, many years to, there's a famous Olympic coach, Russian, who tells a story about how he would take in relatively young athletes at the age of 20 and followed them for 40 plus years. And 40 plus years, those same patients, those same professionals that were able to move certain amounts of weight at that age, 40 years later could do just about the same simply because they remained flexible. Mm-hmm. Stretching and hydration are the two things that most adults just do not do. And it gets us in a whole boatload of trouble.
Boy, okay, yeah, we have talked about that. Okay, so you're saying lack of stretching plus the lack of hydration.
Correct.
Okay.
Correct, and they do go hand in hand.
Okay, so let's talk about some of the things that we do need to know about, because you're talking about this should be on a regular basis?
Should be on a regular basis,
okay.
And I'm a firm believer, and I practice myself stretching twice a day, a few minutes in the morning, a few minutes at night before bedtime makes a big, big difference. And if it's a crappy day, I'll sneak into a room and stretch some more. It does make a big difference. And there's all different ways of stretching, and I'm a huge, huge fan of nice, relaxed, gentle stretching. And I'm a fanatic about telling people, do this at home. You should be doing it every day. It's okay to go to a yoga studio 2-3 days a week if you want, but don't use that as an excuse you're not going to stretch that day. Because when you don't stretch on a daily basis, you end up having a lot more problem. And flexibility does reduce potential injury.
Okay.
So the second thing is you're, by stretching regularly, reducing muscle tension and stiffness. You know, again, one of the more common things we experience as we get older is stiffness of joints and that type of thing. Maintaining flexibility or actually improving flexibility can make a big difference in how we feel throughout the day. Yeah. Stiffness, soreness, and so on.
Okay.
And then the third one, which is really cool, so we mentioned here about improved blood circulation. Stretching actually promotes circulation, but the other thing that's come out in research is that stretching actually improves the health of our blood vessels.
Oh, okay.
Yeah, because we're stretching more regularly. We're actually, of course, stretching the veins and the arteries to a certain extent. That actually improves vascular health.
Oh, wow.
Yeah, that's something a lot of people aren't aware of, but I think it's really important to note. Better posture automatically results from this. I can tell you time and time. In fact, I had a patient this morning, the same scenario. She related how much better her posture is after she stretches.
Oh, that's great.
Yeah,
okay.
Exactly. So that, again, combined with resistance exercise is a game changer for posture. And then stress relief. Engaging in gentle stretching does trigger the body's relief of endorphins, which are chemicals that make us feel good. They're the feel-good hormones. These themselves also can help eliminate stress and improve our moods.
Wow. Well, it sounds like a lot of these will help, in the day-to-day lives, but also for long-term as well. Because we all know that I think the older we get, we have more difficulty wanting to get up and stand, and we see that some people have a lot of pain, and so maybe there is a way to reduce that if you earlier get into this.
Well, there is, and for people that haven't done it in a long time, they oftentimes need some additional care to get back to the point where physical therapy, even some of the pain management tools that we use in the office, like laser, soft wave, ultrasound, and even assisted stretching, can go a long way. But, getting there does make a big, big difference, and then staying there means everything.
Now, Doctor, for people listening in and they say, okay, so I need to do stretching twice a day, Dr. Hayes, I don't even know where to start. Like, how do I know if I'm doing it right? What kind of can you give us just an example of what you think someone should start out with?
Well, it's
and
different.
How long?
It's different for everybody.
Okay, all right.
The general caution I would say is be careful of what you do standing.
Okay.
Early on, you're better off. If you're just starting out, I'll tell patients, listen, lay on your back in bed. Before you get out of bed, bring your knees to chest. Start with one knee to the chest, then do 2 knees to the chest. Start from there.
Yeah.
And then gradually improve from there. Now, that's a very, very nonspecific generalization, but it's a safe place to start. I do see people, especially after the first of the year, going to fitness classes and that type of thing for, that they haven't done in a while or never.
I think that can be dangerous.
Well, it is.
Because it's all of a sudden, that's what I was saying. As soon as someone hears I better do that. I want mega stretching 101.
Quite frankly, it is. And one of the biggest ways people hurt themselves is trying to do some of these stretches from standing, which their body's just not used to.
Yeah.
Be careful. Get some help.
Okay.
Yeah.
All right, lots of good stuff, and people should read the blog, Dr. John Hayes, and get more information about all of the different benefits, because there are many, and there's some that come right to mind, but it looks like, according to the list here, there's some that I think some people probably wouldn't realize.
Yeah, there's a ton of them, actually, and for those people that are patients in our practice, we can actually email you or give you a hard copy of the stretches that we most commonly recommend.
Oh, that's great.
Yeah.
All right, Dr. John Hayes, he's got a direct primary care practice. It's in Marshfield. It's on School Street. You can read this blog on his website, drjohnhayesjr.com, and you can call or text his office at 781-659-7989, 781-659-7989. Dr. John Hayes Jr. is with us every week at this time on WATD. Thank you, Doctor.
Thank you, Rob.